All right, I'm just going to check with my doctor's orders. Patient has a chest tube. Just need to do a full assessment and assessing the chest tube, so we're going to head on in. Good morning. My name is Elise. I'm going to be your nurse today. Can I have you verify your first and last name for me and your date of birth?
Yeah, my name is Ladasha Richardson. Date of birth is 05/23 of 2000.
Okay, wonderful. Good morning, Ladasha. We're going to just do a quick assessment today. We're going to take your vital signs, do and assess like your heart rate and breathing, and then I'm also going to take a look at your chest tube.
Okay.
So before we get started, I just want to see, what has your pain been at recently on a scale of like 1 to 10, 10 being the absolute worst? Where do you feel like your pain's been at?
Probably like a 4.
Okay, you feel like your meds have been able to keep it controlled a bit?
Yeah, it hasn't been too bad.
Okay, wonderful. We want to stay at your like your pain goal. So 4 is pretty good. If we can keep it there or lower, that's great. If it starts getting a lot worse, please press the call light and let me know. But I'm going to go ahead and close these drapes to give us some privacy before we get started on your assessment. Alrighty. Okay, close the blinds. We're going to say that she has some good privacy going on. Alrighty, before the assessment, I'm just going to put on some gloves. All right, so I would want to get a full set of vital signs. I'd want to get oxygen, pulse, heart rate, blood pressure, all that good stuff. I am just going to go in and listen to her heart and also listen to her lungs. Make sure that everything's good. Later I will document those findings in that assessment. Okay, after I finished with her vital signs, I'm gonna go ahead and take a look at her chest tube and assess that. I'm just gonna lift your gown here, Ladasha, and just take a peek at your chest tube and drainage system. So everything's looking nice and clear, dry, nothing's soiled, so that's really good. So it doesn't need to be changed right now. And it looks like her tube is still at 20 centimeters, and that's like kind of the typical length. So I'd want to check and make sure and compare it to the patient chart. Make sure it's the same as it was previously documented on insertion. If it's pulled out at all, if it has, the numbers changed, whether it's been inserted too far or pulled out a bit, want to make sure that it's back at that normal range. After inspecting, I'm just going to lightly palpate, just make sure that there's not any crazy excess goopy stuff coming out, and nothing's soiling the bandage. Everything's looking good. So after finishing that, I'm just going to follow the tubing. I'm going to make sure nothing's looped or kinked. I'd want to undo that if it were, because it can impact the sectioning. So I'm going to follow the sectioning to the machine, and then the machine set up to wall suction. We're just trying to simulate the fact that it is on. So I'm going to come back to the machine. All the lines are all connected, so that's really good. Come back to the machine. This would normally be on the floor. You want it below the level of the person's chest. So have gravity help us with the sectioning. But for the sake of simulation, we're going to have it up here. So usually if this thing's on, you're going to have this orange bellow kind of popping out, and you want it within this window range. If it is too shallow or not inflating enough, then you have problems with suction. But when it is in this range, you want it kind of pulsing a little bit. That just reflects their normal breathing. If it's pulsing too much, you got something wrong with the section or elsewhere in the machine. But for the sake of simulation, we'll just say everything's looking good here. Now we're going to follow it down to the suction chamber with the water level. So you want it here at this 2 centimeter line, which is looking really good. You want a nice continuous bubble. It's not obviously happening. If this were to happen and there were no bubbles, that would mean that there is a kink in the tubing, and you'd want to check and make sure that nothing's kinked to even out the line to ensure proper bubbling. If there was too many bubbles and it was kind of like boiling water in here, roiling bubbles, that means that there's a leak and a problem with the drainage system. So usually on the bedside, you want to make sure that you have a clamp as well as gauze with Vaseline. So if there is a leak, you can then take the clamp and go onto the tube and go at 10 centimeter increments, and then check to see if the bubbling stops with each 10 centimeter increment. And then once you find that where the leak is, you would take your gauze with Vaseline, apply it onto the leak, just to ensure a closed system here. It's a temporary fix until you can get somebody in to replace the tubing. But for the sake of this, everything's looking good with the suction. We'll just go over here, and this is all the fluid that's being drained. I'd want to check and see where we're at. It looks like we're at about 260 serosanguinous fluid. You'd want to compare that with previous documentation, make sure that what's coming out is consistent. You don't want any like bright red fluid in here because that just shows that you're suctioning up any internal bleeding. So this is looking good, but once again, I'd want to check it with the previous documentation. But yeah, we've got everything going on here. For the sake of simulation, say that it's all correct. Then I can go ahead and cover the patient. All right, LaDasha, everything's looking good with your chest tube system. Just let me know if you start seeing any like soiling at that site where it's inserted, or if you pull it out a little bit, or if it starts getting uncomfortable, like shoved in there a little too much. Please press that call light. We want to make sure that we get on top of that so it's sectioning properly, and we don't want to damage your lungs as well as the space around your lungs. And if you do notice that this stops bubbling, any sound stops that's normally going on, or if it's bubbling too much, please also let me know, because that could mean that something's wrong with the tubing, and we can come on in here and troubleshoot, make sure that everything's working the way that it should. Also, once again, please let me know if your pain starts getting out of control and the medications aren't staying on top of that. We can see what we can do in addition to bring you back to your goal pain, your pain goal. So once again, your call light is just right here by your hand. Press that big red light and I'll come in and help you out best I can. So make sure that the bed is low and locked. Patient's head is upright. Call light is within reach. Side rails are up. Everything is looking good. Just gonna go ahead. I can take off my gloves. Hand hygiene. LaDasha, I'll be back in to check on you later today. Just gonna go ahead and document. I'll document my assessment, the vitals, as well as any findings here. Everything looked normal. I document how much fluid has accumulated and the integrity of the fluid, which is serosanguinous, and I just want to make sure when documenting that everything's looking consistent with previous findings, and if there's anything abnormal, I'd notify the provider.